From stories around the world to stories here at home, this is the national news broadcast. I'm the listener Sadish Kumar.
Good evening, I'm Clifford Richards. First of all, we take a look at the headlines.
3 persons killed in a stampede in Maligavatta. The President instructs to streamline the pharmaceuticals by removing the intermediaries. A national program for the development of cricket. Legal action against mill owners who are not converting paddy into rice. The effects of the cyclonic storm declines. 29 multi-day trawlers swept away to the Indonesian Sea, back to the country. 84 die in India and Bangladesh from cyclone Amphan.
In your local stories this evening, 3 women were killed in a stampede occurred while donating cash during a private aid distribution program conducted in a house located in Jumma Masjid Road in Maligavatta this noon. Another 9 injured persons have been admitted to the Colombo National Hospital. 6 persons have been taken into custody over the incident. A large crowd had gathered to receive the money and victims were killed during a stampede occurred near the house in the process. 6 persons who had organized the private donation program have been taken into custody. According to reports, nearly 400 to 500 people have gathered to receive the cash provisions distributed by a businessman in the area who was donating money for Ramzan festival. Senior DIG Deshabandhu Tennakon said that the organizers had kept them inside the premises in order to prevent the recipients of the cash donations to return for more donations. Necessary steps will be taken against the offenders under the Quarantine Act and Penal Code for the negligence in adhering to health instructions to avoid public gatherings during the COVID-19 crisis.
President Gotabaya Rajapaksa has instructed the chairman of State Pharmaceuticals Corporation to streamline the supply of medicinal drugs while removing the intermediaries. The President directed these instructions during an exchange of opinion and also suggestions over the production and importation and also the distribution with the chairman of the State Pharmaceuticals Regulatory Corporation and also the State Pharmaceutical Manufacturing Corporation as well. Responding to a query directed by the President, the chairman of the State Pharmaceuticals Regulatory Corporation, Dr. Prasanna Kulasekara, said that the distribution process is carried out within 3 mechanisms: state sector production, private sector production, and imports of both the sectors. The chairman of the corporation said that shortages in several pharmaceuticals occur due to months-long periods taken for the procurement procedure in the importation process. The President said that the required quantities of pharmaceuticals for the next year should be decided by studying the trends in demand in the previous year. The President pointed out that the production and supply of medicinal drugs should be streamlined, considering the needs of the public and not on the profits earned by several intermediaries. The President said that the preparation of a simple process for the importation and supply of medicinal drugs should be a top priority. While emphasizing that all pharmaceuticals should be of high quality, the President instructed authorities not to leave any room for the importation and production of substandard medicinal drugs. The need to maintain protective stocks of pharmaceuticals to avoid any shortages in the country was emphasized during this occasion. The President pointed out that all pharmaceuticals should be ordered while considering the expiring dates as well. Chairman of the State Pharmaceutical Manufacturing Corporation, Dr. Utpala Indravansa, said that his institution is currently in the process of manufacturing 80 types of medicinal drugs required by the hospitals. He pointed out that plans have been made to manufacture many medicinal supplies, including saline, locally. He said that the nation will be able to save up to a sum of around 1,300 million rupees per year. The possibility to invest the funds in the Employees Provident Fund and the Samurdhi campaign for the pharmaceutical manufacturing industry was also discussed during the meeting. President Gotabaya Rajapaksa pointed out that an opportunity to earn a stable revenue for both funds will be facilitated through the preparation of such mechanism. Secretary to the President, Dr. P.B. Jayasundara, Secretary to the Health Ministry, Major General Sanjeev Monisingh was present at this occasion.
Co-Cabinet spokesman Minister Dr. Bandula Gunawardena says that the government is unable to pay the 5,000 rupees allowance for the affected public due to a notice issued by the Election Commission. He made these remarks during the media briefing held to announce the cabinet decisions at the Government Information Department. Co-cabinet spokesman Minister Dr. Bandula Gunawardena said that the government has already spent over 50,000 million rupees to distribute the 5,000 rupees allowance for the public affected from the COVID-19 pandemic in the country. He said that the government had taken the decision to pay the allowance for the affected public even by taking bank loans for the months of April, May and June. He said that this program was carried out without any political discrimination. However, he said that honoring the stance of the Election Commission, the Cabinet of Ministers announced that the government is unable to pay the 5,000 rupees allowance for the month of June due to the present circumstances. The minister said that the Mahapolu scholarship will be continued without a failure. Minister Dr. Bandula Gunawardena said that the funds for the Mahapolu scholarship was obtained through the lottery sales. However, he said that the sale of lotteries was completely halted due to the present situation in the country. That provisions have been allocated to credit the necessary funds for the months of April and May into the bank accounts of the children.
මේ මාසයට පසුගිය මාසයට අවශ්‍ය මහපොළ ඒ දරුවන්ගේ ගිණුම් වලට බැර කිරීම සඳහා අවශ්‍ය විධිවිධාන යොදලා ඒ මුදල ලබා දීලා තියෙනවා.
වෛද්‍යවරුන්ගේ
The Cabinet of Ministers have reached a decision to increase the retirement age of the state physicians from 60 to 61. Co-Cabinet spokesman Minister Dr. Ramesh Patrina said that the President has decided to appoint a committee to submit recommendations on increasing the retirement age limit covering all fields in the sector. He said that measures will be taken under the guidance of the Prime Minister to establish flu units in every hospital as the nation has to live along with the COVID-19 virus in future, although the situation in the country has been controlled.
Prime Minister Mahinda Rajapaksa instructs the authorities to prepare a national program for cricket. The Prime Minister made these remarks at a meeting held at Temple Trees today to discuss on the issues pertaining to the field of sports, including cricket. The Prime Minister instructed to prepare a national program with the coordination of the Minister of Sports and also the veteran cricketers and officials of the Sri Lanka cricket. The Premier requested to submit a relevant report in this regard within a period of 1 month. The Premier further said that all sports as well as cricket should be further developed and the priority should be given to sports which could reach international levels. He emphasized that the aspiration of the nation is to take the game of cricket into greater heights. During the meeting, attention was directed on the proposed construction of the cricket stadium in Homagama. The Premier decided to allocate the funds for the development of schools cricket and also the existing stadiums instead of the proposed construction of the new cricket stadium, considering the opinions, suggestions and the views of the veteran cricketers and other experts in the field of cricket. Prime Minister Mahinda Rajapaksa said that a new program should be implemented to improve the game of cricket in the country. He said that other sports, which should also be promoted among children, have no financial strength. He said that if Sri Lanka cricket has excess funds available, then it would be a great service if those provisions can be allocated for these sports. He said that the national sport volleyball should also be financially supported by them so that others would be able to encourage and sponsor these sports events.
Secretary to the Ministry of Trade Badrani Jayawardena says that the existing rice shortage has been fabricated as adequate rice stocks are available in the country for the consumption of the public. A special meeting in this regard was held with rice mill owners under the patronage of Minister Chamal Rajapaksa yesterday at the Ministry of Agriculture. Rejecting the fabricated reports on shortage of rice in the country, Secretary to the Ministry of Trade Badrani Jayawardena said that adequate rice stocks are available in the country for consumption purposes. She said that the government has imposed a set price rate for rice to safeguard the public. She said that legal actions will be taken against mall owners who have failed produce rice from paddy and those who increase the price rates of rice through the Consumer Affairs Authority.
And on to some stock market related news. The S&P SL20 index closes, that's at the Colombo Stock Exchange, gained 6.98% during trading today, bettering the record for the highest ever daily percentage in this index. The index gained 132.90 points to close at 2,037.04 points today. And meanwhile, the all-share price index also gained a 2.78% close at 4,784.80. The market turnover was more than 2.3 billion rupees.
The all-share price index gained 2.78% to close at 4,784.8, and the S&P Sri Lanka 20 index gained 6.28% during the trading today, bettering the record for the highest ever daily percentage gain of the index, which stood at 5.25%, which was set on 18th May 2020, and the index closed at 2,037.04. A 2.3 billion turnover was recorded today, with over 51 million shares changing hands.
A total of 604 COVID-19 infected patients have recovered and been discharged from hospitals in the country thus far. A total of 432 infected patients are still receiving treatment in hospitals at present. Meanwhile, 17 new COVID-19 patients have been recorded in the country today. 2 new COVID-19 infected patients have been identified as 2 personnel of the Sri Lanka Navy, directed to the Mullaitivu Quarantine Centre. The rest of the 15 infected patients have been identified as returnees from Dubai, directed to the Giragama Quarantine Centre. According to a report issued by the Epidemiology Unit, 20 patients have recovered from the disease and were discharged in the last 24 hours. Only 1 COVID-19 patient was reported from the country yesterday, and the patient has been identified as a returnee from Kuwait. Director General of Health Services Dr. Anil Jasinghe said that several countries have been identified as high-risk countries. He said that a total of 1,108 PCR tests were conducted in the country. He also said that apart from those who engage in health-related services as well as cleaning and food handling services, others are not required to wear gloves.
තමයි ඉන්නේ උදාහරණයක් හැටියට ආහාර පරිහරණය කරන්නන් එහෙම නැත්නම් පවිත්‍රතා සේවයේ යෙදෙන උදවිය මෙසේ අත්වසුම් දාගෙන පාරතොටේ ඇවිදීමේදී ඔවුන් නැත්ත වශයෙන්ම COVID-19 පමණක් නොවේ වෙන විස බීජ පවා පතුරන පුද්ගලයන් බවට පත්වන්නට පුළුවන්.
Biosamples were taken from 88 persons, including bus drivers, bus conductors and three-wheel drivers at the Galle main bus station for PCR tests today. A group of 109 Sri Lankan nationals returned from Indonesia this morning and were directed to quarantine centres. A group of 10 persons left the Busa Sri Lanka Navy Quarantine Centre today after successfully completing the quarantine process. Special Action Review Committee of the Ministry of Health was convened today under the patronage of Minister Pavitravani Arachi. A series for new lifestyle COVID-19 prevention signals has been introduced by the Ministry of Health, which will be displayed in public spaces and also bus stations, supermarkets and offices. Also, the ministry reached several decisions, including the preparation of recommendations on wearing face masks, disinfection of public spaces, adequate protective gear and also medicinal equipment to carry out PCR tests, to grant approval for the directors of relevant institutions to conduct PCR tests with necessary medical equipment following the reopening of the country. The Ministry of Foreign Relations has said that the Sri Lankan embassy in Abu Dhabi has been temporarily closed as 5 members of the embassy staff have been identified as COVID-19 patients.
Well, now Corona news from the Europe. German Chancellor Angela Merkel has proposed to extend massive funds to the European Union's weaker economies, making one of her boldest moves in 15 years in her position as the German Chancellor.
Much like on many past issues, Angela Merkel and Emmanuel Macron are now united on a strategy to help member states out of the current economic crisis. A strategy which spurred Merkel to make one of her boldest moves in 15 years as German Chancellor. But sources familiar with discussions at the highest level have revealed the tensions and disagreements between the pair that existed until very recently. Finance ministers agreed on April the 9th to an EU-wide rescue plan worth €500 billion. It was, though, too little to fund a long-term recovery, and bitter feuds festered on. Merkel was insisting that any recovery plan must consist of short-term repayable loans. She was against a proposal by French President Emmanuel Macron for a recovery fund that would, for the first time, bind all 27 member states to raise debt jointly. But according to an EU official, Merkel began to realise that the EU's lack of support for member states was not a good look. Merkel and Macron began talking, but it was Germany's own constitutional court that tipped her hand. On May the 5th, it delivered a ruling that challenged the EU's reliance on the European Central Bank money printing to keep its weaker members' economies afloat, and the EU's governance. According to one senior diplomat, Merkel declared, "It's up to us, the governments." Various sources have revealed how Merkel dropped Germany's long-held opposition to mutualising debt to fund other member states when it became clear the EU itself was in peril. And it pushed Merkel to bold action, to propose huge cash handouts to the EU's weaker economies. The European Commission, which will present its own proposal on May the 27th, warmly welcomed the initiative. But the deal is not done yet. It needs backing from all 27 member states. Austria's leader has said that he, along with the Netherlands, Denmark and Sweden, will offer only loans, not grants.
On a global perspective, the global coronavirus cases surpassed 5 million yesterday, with Latin America overtaking the United States and Europe in the past week to report the largest portion of the new cases globally.
More freshly dug graves at this cemetery in Sao Paulo, a grim symbol of how Latin America is facing an increasingly difficult battle with the coronavirus. Global cases surpassed 5 million on Wednesday, with Latin America overtaking the US and Europe in the past week to report the largest portion of new cases globally. Latin America accounted for around a third of the 91,000 cases reported earlier this week. A large number of those new cases came from Brazil, which recently surpassed Germany, France and the UK to become the third largest outbreak in the world, behind the United States and Russia. Cases in Brazil are now rising at a daily pace second only to the United States. It represents a new phase in the virus's spread, which initially peaked in China in February, before large-scale outbreaks followed in Europe and the United States. The first 41 cases of the new coronavirus were confirmed in Wuhan, China, on January 10th, and it took the world until April 1st to reach its first million cases.
Well, now Argentine scientists are producing a new coronavirus test called NeoKit COVID-19, which costs around $8 and allows the detection of the virus in less than 2 hours.
Scientists in Argentina are producing what they call a fast and inexpensive coronavirus test, which the government there says has attracted international attention. The new test is called NeoKit COVID-19, and developers say it costs around $8 and gives results in less than 2 hours. Santiago Huerba is an epidemiologist at the Pablo Casara Foundation, an organization that created the public-private entity where the test was created. He says the test's ease of application sets it apart from its rivals and allows for mass testing.
The costs are low, about $8 American, and it's easy given the time it takes and that it can be used on an outpatient basis for massive testing. Its availability is bigger than current techniques.
It works by mixing a liquid solution in the sample with coloring determining the status of the patient. Violet means negative and blue is positive for COVID-19. Argentina's government says the first 10,000 tests will be produced over the next 10 days and will be used by the public health sector. And according to Roberto Carlos Salvareza, the country's science, technology, and innovation minister, Argentina is willing to supply other nations with this rapid test.
The test allows for provisions for the country, of which Argentina will have priority as its main beneficiary. Of course, we will be willing to supply not only our neighbors but other countries with the test. In fact, there's already been contact with foreign embassies on the possibility of accessing the kit.
More than 108,000 tests have been carried out in Argentina so far, and more than 380 deaths from the virus have been reported.
And coming back home, following institute and also personal donations along with direct deposits, the Itukama COVID-19 Healthcare and Security Fund has reached rupees 1,136 million today as at May 21st. Kanawin Hotel and Spas Private Limited donated 1 million rupees and the cheque was handed over to President Gotabaya Rajapaksa by Premier Mahinda Rajapaksa at the Presidential Secretariat today. Built Element Limited contributed 3 million rupees and Maskins Private Limited donated 1 million rupees. Exim House Distributors Private Limited, Exim House Private Limited and Cyril Samarjeev contributed 250,000 each. The staff of the Tower Hall Theatre collected a sum of 90,637.69 rupees, while the staff of the Inland Revenue Department collected 3 million rupees for the fund. In addition, J.P. Dayananda De Silva donated 100,000 rupees to the fund to battle the COVID-19 pandemic. Local as well as foreign donors have made their contributions to the fund. Donations to Itukama COVID-19 Healthcare and the Social Security Fund have been exempted from taxes and foreign exchange regulations. Deposits can be made through checks, telegraphic transfers and also via www.itukama.lk website or by dialing #207#. More information can be obtained through telephone number 076 0700 700 or 0112 320 880 or 0112 354 340 or 0112 424 012. President Gotabaya Rajapaksa has presented a proposal to transform Sri Lanka Transport Services into a profitable leading institution in the country. The President pointed out that the Sri Lanka Transport Board can be transformed into a state institution which can extend funds to the Treasury as well, instead of obtaining funds from the Treasury for necessary functionalities. The President made these remarks in a meeting held at the Presidential Secretariat this evening to review the present situation of the Sri Lanka Transport Board. The President pointed out that the importance in including those who commute in their motor vehicles during weekdays to the public transport service in order to ease the severe traffic congestion prevailing during weekdays. A proposal was made to introduce a necessary mechanism to allocate a selected location to park personal vehicles and continue to travel to their relevant workplaces using the public transport. The President said to deploy bus services with maximum facilities in this regard. A discussion was held on improving school transport services, prioritizing the safety of the students while applying yellow color on school buses to prioritize the service when traveling on main roads. The importance of using two colors for both SLTB and private bus services was emphasized during this meeting. The President pointed out that necessary steps should be taken to introduce a new mechanism to provide incentives for employees and to control negligence, corruption and misuse in the service. He also said that the SLTB should utilize the staff of 4,500 technical officers to their maximum capacity. Instructions are given to proceed with the total mechanism of the service in accordance to a short, mid and long-term plan. Secretary to the President Dr. P.B. Jayasundara and Chairman of the SLTB Kingsley Ranawaka were present.
The Department of Fisheries says that 29 multi-day trawlers stranded in Indonesian seas after being swept away due to the cyclone Amphan expected to return to the country in future, and Sri Lanka Navy's Samudra ship along with necessary supplies has set sail to the Indonesian waters to assist the stranded boats. Department of Fisheries took steps to bring back 1,500 out of 2,000 multi-day trawlers which were sailing in the deep sea areas in the country prior to the cyclone Amphan. However, 30 ships had sailed towards Indonesian seas in accordance to the instructions given by the department through radio channels. The boats had left the country from southern and Trincomalee coastal areas in late April. They were anchored at a distance of 850 nautical miles away from the country. 29 trawlers along with 180 fishermen have commenced sailing towards the country at present after decline of the cyclonic situation. The fisherman has informed the Kaprathota Search Operation Center in Waligama that they are in good health condition. Meanwhile, one ship has encountered a technical faulty and unable to return to the country at present. Therefore, Sri Lanka Navy ship has been deployed in aid of the trawler. The standard speed of a trawler is at 6 nautical miles per hour. However, the speed has been drastically dropped due to the activation of the intermonsoon.
The eastern Indian city of Kolkata has been devastated by a powerful cyclone which has killed at least 84 people across India and also Bangladesh. Storm Amphan struck land on Wednesday, lashing coastal areas with ferocious wind and also rain. It is now weakening as it moves to the areas of North Bhutan. Thousands of trees were uprooted in the gales. Electricity and telephone lines brought down and houses flattened. Many of Kolkata's roads were flooded and it's 14 million people without power. The storm is the first super cyclone to form in the Bay of Bengal since 1999. Though its winds had weakened by the time it struck, it was still classified as a very severe cyclone. Coronavirus restrictions have been hindering emergency and relief efforts. COVID-19 and social distancing measures made mass evacuations more difficult. While shelters unable to be used to full capacity, Amphan began hitting the suburbans, a mangrove area around the India-Bangladesh border as well.
Secretary to the President Dr. P.B. Jayasundara informed the Supreme Court that the Gazette notification issued by the President to dissolve the Parliament would not be invalidated by postponing or changing the date to hold the election. The Election Commission has the power to change the election date after declaring a date to hold the general election following the dissolution of the Parliament. President Counsel Ramesh De Silva, representing Secretary to the President Dr. P.B. Jayasundara, made these submissions when the fundamental rights petitions filed with the Supreme Court challenging the June 20th general election date. Today was the fourth day to consider the petitions before the 5-member Supreme Court judge bench, including Chief Justice Jayanta Jayasuriya. President Counsel Ramesh De Silva pointed out that the conduct of the general election was delayed due to the actions taken by the Election Commission. Accordingly, he alleged that the sovereign voting right of the public has been violated due to these measures. He also pointed out that the election can be held within 1.5 months period, as the process to accept the nominations has been completed. He questioned the impartiality of the Commission when 2 members of the Commission bear one opinion while the other member has a different and opposing opinion in this regard. He also said that the Parliamentary Election Act decides the time period to accept the nominations after declaring the date to hold the election following the dissolution of the Parliament. Therefore, he pointed out the possibility to accept nominations, though a government holiday has been declared during the period to accept nominations. Power has been vested with the President to utilize the financial provisions from the Joint Fund for State Expenditure up to 3 months following the convening of the new Parliament. Therefore, the President Council questioned the illegality in utilizing funds from the Joint Fund for State Expenditure. He added that the approval of the dissolved Parliament is not required in this regard and said that only the new Parliament can grant approval for this measure. After considering submissions, the hearing of the petitions was postponed till tomorrow.
Well, that's it on the news. Do enjoy the rest of the programs. Take care and good night.
Good night.